My name is Briley. I'm going to be your nurse today. I'm just going to go ahead and shut the curtain and the door for a little bit of privacy. Today what we're going to be doing is we are going to be doing your wound dressing change, and we're going to clean it while we're there. I'm just going to go ahead and check to make sure you don't have any tubes, drains, cords, or anything that can kind of mess us up. Okay. Are you having any pain today? No? All right, so the medication that I administered about 30 minutes ago is working. Perfect. Okay, I'm just gonna raise the bed to a comfortable working height for me to kind of help my back as I do this procedure. All right, and I am going to do some hand hygiene. And I am going to put on some gloves. And the first thing that I'm going to do is I am going to just take off your old dressing. I have a garbage right here. Okay. All right, so we'll keep you covered. And it looks like you have a chuck underneath you, so I don't have to worry about anything kind of getting onto the sheets. All right, so I'm just going to expose your wound here and leave the rest of you covered. And I'm just gonna grab my cart here. Okay, the first thing I do is I'm going to remove the dressing with the hair, the direction of hair growth. And I'm just going to kind of look at if there's anything soiling the draining, which there is not, the dressing, which there's not. And I'm going to remove the gauze that's packed in here, and I'm just going to assess the wound kind of for color, odor, shape, size, any drainage, but everything is looking pretty good today. And now I am going to measure. Now this is a sterile measuring device. So I'm only going to touch the end, and I will not touch it to the wound. I'm just going to measure the length, which is about 14 centimeters, the width, which is about 2.5 centimeters, and the depth, which is about, again, well, 3 centimeters. All right. Now that I am done with that, I'm gonna take off my gloves and we're gonna get you ready to put on your new dressing. So I'm taking off my old gloves and I'm gonna perform hand hygiene. And now I'm going to open my sterile field. The first thing I'm going to do is open my kit. And now I'm gonna do my gloves. Okay, now I'm going to take the sterile contents out of my kit. I'm actually going to get rid of that first. Take care of that later. Just going to get everything set up here to clean and redress the wound. Okay, and this is just my biohazard bag that I'm going to open up and place here to put my hazardous materials in. Just gonna mind the 1-inch border. this is my saline. I'm gonna open. And dump into my container. Now I'm just gonna get the gauze wet. Okay, and I'm going to clean the wound. I'm gonna go from dirtiest to cleanest, inside to out, top to bottom. So I'm gonna do one swipe, a new piece of gauze every time. This way. And I'm gonna do this side. And now I'm just going to do the outside. Now I'm going to dry the wound with dry gauze. See, my sterile field is wet here, so this is when I would restart with a new pack contents because my sterile field is contaminated even though it is sterile water. But continuing, I'm just going to clean with some dry gauze. Again, top to bottom, one swipe with each. Okay, and now that it's dry, I'm going to pack the wound with my new dressing. Kind of just gauging here how much I'm going to need. Okay, and now I'm going to apply the new dressing over top, just like this. And now my gloves do not need to be sterile because I am done with all of the wound cleaning and stuff, so I can go ahead and pull these back a little bit more because my gloves are no longer sterile, but I do need to add tape, which does not need to be sterile for me to do, to the outside of the skin. I'm just gonna tape only where necessary. Just enough to keep the dressing on, but not enough that will damage the skin around the dressing. Okay, and now what I'm gonna do is I'm going to write the date and time that the dressing was placed. Just gonna stick this on the dressing. And I'm going to clean up all of my supplies, and I would dispose of my biohazard waste in a different receptacle.